get set, go! Remember when you used to do that as a kid? I think we did it for everything we did as kids. So what does that mean? Well, it marks the starting point. It's the green light, and it defines the beginning of the race. Today we're talking about the starting point for estrogen replacement therapy. And so I'm teaching you everything about menopause. And one of the things about which you need to know, whether or not you choose to use it, is estrogen replacement therapy. We've been dissecting all the nitty-gritty details about estrogen replacement therapy. And in the last few tutorials, you've learned about something called your estrogen window of opportunity. And now you know that it addresses taking estrogen to prevent heart attack, osteoporosis, and Alzheimer's disease. And then you learn that you have to take an estrogen that travels throughout your entire body at a certain dosage in order to accomplish these goals. Plus, you've learned that menopause is an estrogen deficiency state, just like any other deficiency state. So today, we're going to talk about when you should start taking estrogen if you want to use it to prevent these diseases. Now, if you're watching these videos in order, you now know that it's like building blocks, and that what I do is I give you the foundation so that as you add each block makes sense and everything is logical because we're building this one video at a time. So if you find that when you try to add a new block of information, it doesn't seem to work, it doesn't fit, it falls out of place, it might be because you don't have the foundation. So just know that they go in order and they give you the foundation, one video at a time, okay? Now, this video tutorial will only address the starting point for estrogen replacement therapy. It's the on your mark, get set, go video. We are not going to address the finish line until next week. It'll be the next building block. So now maybe you're wondering, well, what difference does it make? Perhaps you're thinking that you don't need to watch a video on when to start estrogen. Maybe you think you can just start anytime. Well, guess what? You can't start just any time. You need to learn the facts about when to start taking estrogen. And this video will tell you exactly what you need to know. Okay, what we're going to do is connect the dots between the starting point for estrogen replacement therapy and that thing called the estrogen window of opportunity that I've been teaching you about in many of the previous videos. Now, you know that the estrogen window of opportunity stipulates that the first 5 to 10 years of your postmenopause is the critical time for taking estrogen replacement if you want to use it to prevent heart attack, osteoporosis, or Alzheimer's disease. So let's talk about this 5 to 10 year time frame. Let's talk about what it means and what it doesn't mean. You know, time frames confuse people, and that's because different people interpret them differently. Just for kicks, let's see how you interpret this time frame of 5 to 10 years. Here's a quiz question for you. The estrogen window of opportunity refers to the first 5 to 10 years of postmenopause when taking estrogen replacement can prevent or reverse some of the life-threatening diseases that are associated with menopause. What does 5 to 10 years mean? A, you should only take estrogen for a total of 5 to 10 years. B, you should discontinue estrogen when you are 5 to 10 years into your postmenopause. C, you should start taking estrogen within the first 5 to 10 years of your postmenopause. D, estrogen will only prevent these diseases in the first 5 to 10 years of your postmenopause. See what I mean? You see what I mean by different interpretations? What did you pick? Here's the answer. It's C. You should start taking estrogen within the first 5 to 10 years of your postmenopause. But it is not as simple as it sounds. So let's discuss this. I'll begin by saying that, I don't really like ranges that are that broad when it comes to time frames. I mean, think about it. 10 years is twice as long as 5 years. I mean, if the time frame were 9 to 10 years, it kind of would make much more sense. But this is the time frame that's given. So when you see ranges of time like this, realize that the range applies to the population at large. Your personal time frame will be something that you and your doctor decide. Everything will be individualized for you, but I want you to understand what things mean. But we are all different, and always remember that you have to tailor things to your own needs. That is why I'm Menopause Tailor. Okay, so here's what the 5 to 10 year time frame really means. It's all about the on your mark, get set, go. It's the green light. 5 to 10 years designates the critical time in your early postmenopause to start taking estrogen replacement to lower your risks for heart attack, osteoporosis, and Alzheimer's disease. 5 to 10 years is the time during which you can still start taking estrogen. Do you know why? It's because this 5 to 10 years of the beginning of your postmenopause is the time when the benefits of taking estrogen outweigh the risks of taking estrogen. You see, everything in medicine is all about benefit versus risk, and you only want to do the things that have more benefits than risks. So this first 5 to 10 years of postmenopause is when you can start taking estrogen, and it'll be safe to do so. If we were talking about running a race, it would be the time when you can still run in the race safely without hurting yourself. If it's been more than 5 to 10 years since you became postmenopausal, you aren't allowed to run in the race. You're disqualified. Now, why is that? Because after 5 to 10 years without estrogen, the risks outweigh the benefits. So now you're probably wondering why the risks of estrogen change over time. And if you're thinking that way, I am so proud of you because it means you're really thinking. Well, it's because the 5 to 10 years is the time during which your body still remembers what it was like to have estrogen on board. In that 5 to 10 years, your body is still healthy enough to participate in the race. It's when not enough time has passed to incur so much aging that your body has forgotten what it was like to have estrogen on board. Now, I just used the word aging, but I want to distinguish between the word age and the word aging. You see, the estrogen window of opportunity is not about your age. It's about the aging process that your body undergoes in the absence of estrogen. The reason women associate menopause with aging is because the absence of estrogen makes your body age, both inside and out. It's the aging on the inside that matters with regard to this estrogen window of opportunity. And without estrogen, your heart, your bones, and your brain begin to age. They aren't the only parts of your body that start to age. I mean, think about your skin. It starts looking old after you transition into menopause, not before. So some people have referred to estrogen as the fountain of youth. And this aging that happens in the absence of estrogen is why they refer to estrogen as the fountain of youth. So that's why taking estrogen in the first 5 to 10 years of your postmenopause can prevent heart attack, osteoporosis, and Alzheimer's disease. It makes sense, doesn't it? If your body undergoes more than 5 to 10 years of aging due to the absence of estrogen, it just gets too old to handle estrogen. And as long as it hasn't been without estrogen, that aging does not occur. In other words, after 5 to 10 years without estrogen, you're just too old to run in the race because you'll hurt yourself. So now, that may lead you to ask, is it okay to start taking estrogen replacement before you're postmenopausal? For instance, is it okay to start during perimenopause? And the answer is yes, you certainly can, and many women do. And the good thing about doing that is that you make sure that your body never has to experience the aging that it undergoes in the absence of estrogen. Now, notice that I'm leaving progesterone out of this conversation entirely. That's intentional. If you have your uterus, you do have to take progesterone with estrogen. But this tutorial is about when to start taking estrogen with regard to the estrogen window of opportunity. So I'm leaving progesterone out of the conversation for simplicity. So the 5 to 10 years of the estrogen window of opportunity refers to the time during which you can still jump on the estrogen replacement bandwagon. It's a time when you can still join the estrogen replacement team and run the race. And the really great thing is that you can start taking estrogen anytime during that 5 to 10 year time frame. So here are some examples. Example number 1. Let's say you're perimenopausal and haven't even reached postmenopause yet. You can go ahead and start estrogen replacement therapy. Why? Because you haven't gone any time without estrogen. Your body is still young and healthy, and the benefits of estrogen still outweigh the risks of estrogen. Example number 2. Let's say you had your last period 5 years ago. Can you start estrogen replacement? Sure, you're still within your estrogen window of opportunity. Example number 3. Let's say you had your last period 9.5 years ago. Can you still start estrogen replacement? You bet. You haven't reached that 10-year mark yet. Okay, but what about more complicated situations? Here's example number 4. Let's say you had your last period 12 years ago, but you took estrogen replacement for the first 5 years and then you stopped. Can you restart estrogen replacement? What do you think? Remember, it's all about how long your body has been without estrogen and how much damage from aging has occurred during that time. So in this example, if you take the number of years since you became postmenopausal, which is 12, and you subtract the number of years you took estrogen, which is 5, the answer is 12 minus 5, which is 7. So 7 years falls within that 5 to 10 year requirement of the estrogen window of opportunity. So you can still restart estrogen replacement. Okay, example number 5. Now, what if you had your last period 20 years ago and you took estrogen replacement for the first 5 years, but then you stopped? Can you still restart estrogen replacement now? Well, let's do the math. 20 years since your last period minus 5 years on estrogen replacement equals 15 years without estrogen. 15 falls outside of the 5 to 10 year time frame for the estrogen window of opportunity, so you cannot restart estrogen. Okay, one last example. This one's even more complicated. let's say you had your last period 20 years ago, and you took estrogen replacement for the first 5 years of your postmenopause. Then you stopped for 5 years, and then you restarted taking estrogen again, and you took it for the next 10 years. If you do the math on that one, you get 20 years since your last period, minus the first 5 years on estrogen, minus the other 10 years on estrogen, and it's only been 5 years without estrogen, right? So in that instance, it may still be possible for you to restart estrogen therapy. You know, all of this is going to depend on your individual situation, how long it's been, how much aging, what your other health problems are. But think of this in terms of how much time you've gone with no estrogen. That is what this is all about. You know, when you start a race with on your mark, get set, go, you only have that 1 second to start when the referee utters the word go, right? But with the estrogen window, you have 5 to 10 years to get started. Now in a race, the earlier you start, the better your chance of winning, right? Well, the same is true for preventing diseases associated with menopause by taking estrogen. But at least you won't lose completely if you start a little bit late. The key is to understand that the 5 to 10 years refers to the time you've gone without estrogen. And ideally, you'll address this in the first 5 to 10 years of your postmenopause. But even if it's been more than 5 to 10 years since your postmenopause, the real issue is how long you've gone without estrogen. And the longer you've gone without estrogen, the greater your risks of starting estrogen. So think of it as the starting point and nothing more. It's those early years of postmenopause that are most critical. So if you've already been deficient in estrogen for 10 years, it may be too late for you to restart it, or for you to start it at all. The estrogen window is the window during which you can begin taking estrogen to gain the benefits, okay? That's what it's all about. So the big message in this tutorial is this. The 5 to 10 years of your estrogen window of opportunity is the time during which you can still take advantage of the opportunity. So if you want to think of it as a time limit, you have a limited time since you've been without estrogen to get started. And you can only start taking estrogen in the first 5 to 10 years of your postmenopause or within 10 years since you last took estrogen. After that, your window of opportunity closes. And as you can see, it's not really about your age. And obviously, menopause occurs at a wide range of ages. It's about when you're still eligible to use estrogen replacement to prevent heart attack, osteoporosis, and Alzheimer's disease. And if your estrogen window of opportunity has closed and you can't take estrogen, it means that you'll have to find another way to prevent heart attack, osteoporosis, and Alzheimer's disease. It doesn't mean that you should give up. It doesn't mean that you have no options. You still have many options. Estrogen just isn't one of them. And for everything we discuss in my videos, I'll give you options in every category. I'll give you diet and lifestyle options, vitamin and mineral options, herbal and botanical options, hormonal medication options, and non-hormonal medication options. You'll have a lot of categories from which to choose. One of the great things about this menopause education I'm giving you is that I'll teach you many different ways to accomplish your goals. So never give up and never assume you have no options. Knowing about this starting time for estrogen is critical because timing is really everything. Okay, so that brings us to the next question, which is when to stop taking estrogen replacement therapy. And that's another area where women make all sorts of assumptions that are completely incorrect. And that's what we'll discuss in the next video. I'm separating the videos on when to start taking estrogen and when to stop taking it for a reason. So don't assume. You already know everything you need to know about when to stop it. I'm going to bet you anything you don't. So until next week, think about what we've covered today and I'll see you in the next video. Don't forget to follow me. I'm on Facebook, Twitter, Instagram. Make comments on the videos, ask me questions, and I'll see you the next time. Bye.